When it comes to breast cancer, I've got good news and more good news. Breast cancer can be prevented, it can be treated, and if detected early, it can be cured. And the cure rates can be high, up to 90% or more. And detecting it early is not impossible. In fact, it takes only a few simple steps to detect it early. In those cases where we cannot completely cure breast cancer, there's still good news. With effective treatment, 10-year survivals can be more than 80%, and people have a very good quality of life. When it comes to breast cancer, most people do not realize that this is the commonest kind of cancer among women, but 1 out of 100 breast cancers can also happen in men. We do know that it's the leading cause of cancer death in women, but treating it and preventing it is possible and is not very difficult to achieve. Let us start with detecting breast cancer. And this is very fortunate because breast is an organ which lies outside the body. Unlike the other organs like lungs and liver, which are inside the body, it is easier to examine the breast and a person can do it themselves. And if there is a cancer growing in there, it's a very good chance that self-examination can detect it. Now, who should be doing self-examination for breast cancer? And the answer is basically all females, especially those who are above the age of 50. The risk of breast cancer goes higher with age, and above the age of 50, the risk is much higher. But you can start examining at a younger age, and examining yourself is not difficult. You can do it in front of a mirror, or you can do it in the shower. And all you're looking for is any lumps or bumps in the breast, any discharge, any abnormality, skin changes, any changes in the nipple, like a nipple inversion. And to examine, you have to check your breasts, you have to check your armpits, the axillae. And I personally recommend my patients to also look under and above the collarbones and have a gentle feel of the neck if there are any lumps or bumps which might need further treatment and investigation. There are 7 steps to doing that. You stand in front of the mirror with arms by the side. Secondly, hands behind the neck. Thirdly, hands on the waist or hip. Then one arm raised and then the other arm raised and then lying on the bed. And in all these positions, you feel your breast and you feel the nipple. And you're looking for any lumps or bumps or any new findings which were not there before. Chances are that if you find something abnormal, it may not be cancer, but it will give you a peace of mind if you get it investigated and if you have tests done for it. And if, God forbid, it is something sinister, an early stage of cancer, you can have it removed and get rid of the cancer before it spreads. Above the age of 50, most developed countries offer a screening program in which a very low dose radiation X-ray is used, known as a mammogram, and this is done every 2 to 3 years. And this would detect any abnormality which might be developing into a cancer. Once detected, further investigations can be done. If it is cancerous, it would be removed. If it is not cancerous, you can just monitor it. Nowadays, non-radiation investigations have come in, like digital mammography, which have lesser radiation involved and are very safe compared to the older techniques. So get yourself enrolled in a screening program through your local physician. If you don't have the service available, try to seek it privately, especially if you have a family history of cancer. People who have a family history of cancer among first degree relatives, they should actively seek a screening program and have a screening mammogram done at least 2 to 3 years. For some patients, a mammogram may not give a lot of information, and for them, an MRI scan is recommended, but you can always consult your doctor and your specialist in this regard. So here there are 3 simple steps to prevent and detect breast cancer. Number 1, self-examination. You can examine yourself once a week or more often if you like. You can do it in the shower or you can do it in front of the mirror. It's easily done, and if you find an abnormality, ask your doctor for further investigation. Please remember, if you're feeling any lumps or bumps in the breast, most probably it's not cancer. High chances it's just a non-cancerous growth, which is very common. However, if there is a chance of a cancer, you have to catch it early, to cure it early, and to get rid of it completely. So it's worth all the hassle if you're feeling any abnormality in your breast. Step number 2, if you're above the age of 50 and in some countries or high risk group where there's a family history of cancer, recommendations are above the age of 40, you should get a mammogram done, again through your doctor or through your private healthcare facility. And the mammogram would show any abnormality which could be further investigated. Once again, most of these abnormalities are not cancer and they turn out to be benign lesions. But if they are cancer, it's worth getting them investigated and getting them treated, because if we catch it early, we cure the cancer. Last but not the least, we can reduce the risk of breast cancer. And some of the simple things we can do is having more fruits and vegetables. That causes up to 10% risk reduction. Exercise gives a risk reduction of up to 14%, 1-4. And avoiding smoking is also beneficial because smoking increases the risk of breast cancer, whether it's a direct smoke or a second-hand smoke from someone else smoking around you. It can increase the risk 35 to 50%. So, healthy diet, regular exercise, and avoid smoking. These are 3 of the many preventive measures which can reduce the risk of cancer, especially breast cancer. My name is Dr. Khan, and you're listening to Killing Cancer Kindly. Thank you very much for your time. Please share the message with as many people as possible because together we can save more lives. Thank you very much.